Good afternoon. Welcome to the National Hypertension Control Initiative. It's a kickoff webinar for community-based organizations. We are so glad to see you here today. Just a couple of housekeeping items, and then we're going to hand over to our MC and stars of the show. So let's just start out really quickly with accessibility. We are running the closed caption or transcript tool on Zoom. You will see on the bottom of your screen the ability to get into the Zoom controls for closed caption. You can either make them bigger or smaller. You can pop a window out and have a running transcript ongoing, or you can turn them off if you find that they're getting in the way of your seeing. So just look at that bottom bar for CC live transcript. A couple other things that'll help you engage in the day: Q&A and chat. Please use the Q&A button to submit your questions. We really monitor the Q&A for questions that can sometimes get lost in the chat area. And you're going to have the ability to upvote your favorite questions so we can get those towards the top for being answered. We're definitely going to be focusing on doing a lot of Q&A towards the end of the session. So as you have questions, please pop them in Q&A. On the chat side, watch for resources, links, share your thoughts, your editorials, your responses. Love to see your engagement over on the chat side. And then just remember to put your questions in Q&A. The slides that you'll be seeing and a link to the recording of this webinar will be sent out following the meeting. So with that in mind, I'd like to turn it over to Leslie Brown, who will be the MC of today's session. Thank you.
Thank you, John. Welcome, everyone. My name is Leslie Brown, and I am the Public Health Program Manager for the state of California for the National Hypertension Control Initiative with the American Heart Association, and I am based in Richmond, California. We are delighted that you have joined us today for the first National Hypertension Control Initiative community-based organization webinar, and even more thrilled to have the opportunity to work with you all to reduce and manage blood pressure levels in our communities. This webinar is intended to introduce community-based organizations to the National Hypertension Control Initiative, funded through the U.S. Department of Health and Human Services, Office of Minority Health, and the Health Resources and Services Administration Bureau of Primary Health Care. During today's agenda, we will discuss opening remarks, information about high blood pressure and health disparities in the U.S., provide an overview of the National Hypertension Control Initiative, and meet the Public Health Program team. Learn about the National Hypertension Control Initiative's community outreach and integration approach, and discuss how your organization can get involved and play an important role in reducing high blood pressure rates in communities. Then we'll have feedback and questions towards the end. I'd like you to remember that this is your webinar, so we want to make sure you get all that you need. So please don't hesitate to engage with us interactively by answering poll questions and asking questions for deeper understanding in the Q&A button. I'd now like to introduce to you all Pamela Garman-Johnson, National Executive Director of the National Hypertension Control Initiative and Vice President of Health Equity and National Partnerships for the American Heart Association, to welcome and share opening remarks.
Thank you so much, Leslie, and good afternoon, and for some still good morning. As Leslie stated, I am Pamela Garman-Johnson, National Executive Director for the National Hypertension Control Initiative and VP of Health Equity and Partnerships at the American Heart Association. You know, we at the American Heart Association are delighted that you have joined us today for the National Hypertension Control Initiative kickoff webinar for community-based organizations, and even more thrilled to have the opportunity to work with you to reduce and manage blood pressure levels in your communities. The AHA is working to increase blood pressure control rates by partnering with community members, local businesses and organizations, and community health centers across the country to remove barriers to health equity and improve health for under-resourced communities. We believe that in collaborating with all of you on the National Hypertension Control Initiative, we can implement evidence-based interventions that can improve both cardiovascular health and COVID-19 outcomes, both locally and nationally, for racial and ethnic populations who need it most. And we can have an 80% control rate with hypertensive patients through collaborating with health centers across the country. So in order to achieve this, we are focused on sustainable and impactful results on a national scale. So we will need robust enterprise-wide collaboration, a rapid and sustainable implementation pace, and a strong commitment to be good stewards of the public's money. We are committed to listening and understanding the community's needs, and I do want to underscore the listening part. We really do want to listen so that it translates into us being able to be the best collaborators, to provide the resources and training tools for both the patient, the person, for program evaluation and other resources in order to improve hypertensive control rates across the nation. This webinar will provide an overview of the National Hypertension Control Initiative, introduce you to the public health program team. I know you will love each one of them. They are a delight, and ways your organization can get involved. And now I will turn it back to Leslie Brown to lead us with the next steps of the presentation. Thank you.
Thank you so much, Pamela, for your opening remarks. I would now like to introduce Indira Case, one of the public health program managers for the National Hypertension Control Initiative based in Central Pennsylvania, who will share information on high blood pressure and health disparities in the US. Take it away, Indira.
Good morning, everyone, and thank you, Leslie, for the warm introduction. Before we get into health disparities and why we are focusing on high blood pressure, I'd like to provide some background on the AHA. At the American Heart Association, our job can be easy to define. We save and improve lives, and our mission statement makes that clear. But there's a lot more to it. Everything we do is grounded in our 8 guiding values, and you can see them on this slide. I won't read them all, but there are 2 that resonate the most with me. One being ensuring equitable health for all, and inspiring passionate commitment, both of which have brought us here today to build alliances and systems in the community to improve the health of all people. And lastly, our strategic value proposition, which defines how we do our work. The AHA is a catalyst to maximize health impact. And on the next slide, you will see how we drive towards equitable health impact. It is important to know that as we strive towards our impact goals, which we will dive into shortly, the equity is always at the core of all that we do. This graphic shows how that happens. The outer ring of these circles shows the American Heart Association's work in communities. We reduce the risk for women, we address community needs, work to end e-cigarette and tobacco use, and we provide tools and programs that empower people to lower their blood pressure. We also work to improve nutrition security, and we build mental well-being. You may ask, why are we doing these things? A little closer look to the center of the circle, you'll see that this work applies to each of our impact areas. We have strategically chosen each of these areas based on science and expertise, showing they are the most effective ways to equitably save and improve lives. And at the foundation of this graphic is what our work actually looks like, both nationally and in our communities. First and foremost, the American Heart Association is a science-based organization. In fact, we're the leading nonprofit funder of heart disease and stroke research outside of the federal government. The funding of this research has led to the latest science-based treatment and prevention guidelines for cardiovascular disease and stroke. Also, in addition to our research, the AHA has a grassroots network of volunteers that has helped make important policy changes at local, state, and national levels. And our social impact fund is an important way that we work in partnership with local entrepreneurs that are addressing social and economic barriers. And finally, our work in emergency cardiovascular care is critical to our life-saving mission. That's a detailed look at how we work. Now that we've talked about the key focus areas of the Heart Association, let's dive into high blood pressure, which is a focus of the National Hypertension Control Initiative. I will share a few of these facts regarding high blood pressure in the United States. First, nearly half of all US adults are living with high blood pressure, and high blood pressure hits communities of color and limited resource communities the hardest. Projections show that by 2035, healthcare costs related to treating high blood pressure could increase to an estimated $220 billion. And lastly, high blood pressure is a leading risk for cardiovascular disease. Next slide, please. That's what's brought us here to this point. And here's why it's important that we are all here right now. This slide shows the official death rates due to cardiovascular disease over the past 10 years. I just wanted to make sure that we were on the correct slide. The overall decline shows promise, but the disparities in deaths are jarring. Black people are 32% more likely to die from heart disease than white people. And while the death rates among Native Americans and Alaska Natives are dropping, they're not dropping at the same rate they are for white people. Lastly, the mortality rate for the Hispanic population is lower than that of non-Hispanic whites. However, it's important that we continue to provide relevant education regarding the risk factors for cardiovascular disease to diverse populations. Next slide, please. You'll see that the story is even worse for stroke. Black people are 45% more likely to die from stroke than white people. For Latinos, Native Americans, and Alaska Natives, the decline in death rates is not keeping pace with the decline for white people. Again, it is imperative that we ensure all ethnic and diverse populations receive access to appropriate education and quality care. We see that health disparities impact racial and ethnic communities, but we also see that health disparities impact rural communities. On this next slide, I'll briefly talk about the various health challenges in rural communities. In general, people in rural America suffer from higher death rates from heart disease, stroke, lower life expectancy, and higher maternal mortality. To improve these health outcomes, innovative and sustained approaches are needed to address the range of challenges faced by rural populations, such as reducing the shortage of healthcare professionals and encouraging new rural-specific team-based care models, leveraging telehealth, exploring sustainable and flexible funding models to support rural healthcare, and improving the health insurance coverage by fostering economic development in rural communities. So now that I shared some statistics about high blood pressure and its impacts on various populations, it is evident why hypertension is a priority for the American Heart Association. And through NHCI, the AHA will build a comprehensive and systematic approach by capacity building, supporting healthcare organizations and performance, and establishing community connections. In addition, we will emphasize the importance of self-monitoring and assist with providing best practices in the implementation of self-monitoring programs. Now that I've shared the various health disparities and challenges within communities, I'd like for you to know that the AHA has developed a 2024 impact goal. Our 2024 impact goal states that every person deserves the opportunity for a full, healthy life. And as champions for health equity, by 2024, the American Heart Association will advance cardiovascular health for all, including identifying and removing barriers to health care access and quality. And on the next slide, you'll see there are a multitude of barriers that we've identified as interfering with our ability to achieve health equity. We're focusing on three major barriers to achieve our 2024 impact goal. One barrier is structural racism. This is a system in which public policies, institutional practices, cultural representation, and other norms work in various and often reinforcing ways to perpetuate inequity within racial groups. Another barrier that the AHA is working to impact and address are the effects of the social determinants of health. These are the conditions in which people are born and live. These determinants are shaped by the distribution of money, power, and resources, and are mostly responsible for avoidable differences in health status and are often the result of structural racism. And lastly, we're working in rural communities and addressing social influences that impact health, such as lack of access to quality education and economic opportunities. As we wrap up our discussion on high blood pressure and health disparities, we'd love to hear from you. Please feel free to share in the chat box the local barriers that exist in your community to achieving health equity. And lastly, I just want to thank you all so much for the time to share information about the work of the AHA, our focus on health equity, high blood pressure, and our efforts to remove barriers. I personally can't wait to meet and work locally with stakeholders in the Eastern States region. And now I'll hand it back over to Leslie.
Thank you so much, Indira, for sharing that information with all of us. We'd now like to engage with you all with a poll question. Does your organization currently have a health initiative focused on any of the following? Hypertension, diabetes, smoking cessation, cholesterol, nutrition, physical activity, stress management, mental health, or maybe any other categories? Please let us know which ones you are working on in your organization. I think we are just about there.
We're at about a third. We'll give this maybe another 10 seconds.
Thank you all so much for participating in this poll with us. And it looks like most of you all are focused in on hypertension, diabetes, smoking cessation, nutrition, and mental health and physical activity. Thank you all so much for participating in that poll. We very much value sharing that information with us. I now like to introduce our next public health program manager, Amy Royer, based in Bozeman, Montana, who will share an overview of the National Hypertension Control Initiative and introduce the public health program team. Take it away, Amy.
Thank you so much, Leslie. Good afternoon, everyone. Today, I am going to provide you with a brief overview of our National Hypertension Control Initiative. And as Leslie said, I will introduce you to our dynamic team. So to start off, I'd like to share that our overarching goal during this 3-year initiative is to increase blood pressure control rates to 80%. We are working with 350 community health centers across the country. And as Leslie mentioned before, these health centers are funded by the Office of Minority Health through the Health Resources and Services Administration. On the next slide, I will share how we are going to achieve this goal. So we are committed to leading the front on a national stage against health disparities, as Pamela and Indira already went into. So these health disparities have always been present, but are more exposed by the COVID-19 pandemic. Through this initiative, we know we can improve cardiovascular health of hundreds of thousands with high blood pressure and reduce the risk of chronic and deadly diseases. We have already launched this initiative and we will sustain progress and have promised extraordinary results on a national scale. So to achieve this, we will need a robust enterprise-wide collaboration, a rapid and sustainable implementation place, and strong commitment to be good stewards of the public's money. On our next slide here, our NHCI framework consists of our 4 strategies. So this is patient and public education, community outreach and integration, healthcare organization and healthcare provider and clinician trainings, and project management and evaluation. So on the next slide, I'll go into a little more detail on each of these strategies. So for our patient and public education component, we will launch a national co-branded PSA campaign focused on blood pressure awareness and education. We're also convening large-scale and virtual and in-person community events targeting racial and ethnic groups that are at the greatest risk for high blood pressure. And we will promote proper self-monitoring techniques of high blood pressure. And through our community outreach strategies, we will include recruiting and engaging community partners such as yourselves, faith-based organizations, barbershops, local health departments, pharmacies, and we will promote the importance of blood pressure management, key signs, and risk factors. So we will be doing this in hopes of increasing blood pressure screenings in the community, and we will also develop culturally and linguistically appropriate resources training, and education to help your communities refer people to the healthcare that they need in the healthcare centers. Next slide, please. Oh, perfect. Thank you. So for our healthcare training component, we are engaging those 350 community health centers in targeted technical assistance to improve high blood pressure control rates through Target BP, our long-standing quality improvement program offered through the American Heart Association. We're also supporting healthcare centers with training and skills building strategies to embed blood pressure monitoring and treatment best practices in these health centers. And for our project management and evaluation strategies, we will design and execute a robust data-driven evaluation, leveraging AHA's existing data platforms and using mixed method implementation research. We're also providing leadership and strategic direction to the initiative in close collaboration with the Office of Minority Health, the Health Resources Service Administration, and critical stakeholders, including the American Medical Association. So our National Hypertension Control Initiative ecosystem consists of 3 pillars. So the patient and person, the 350 funded health centers, and you, our community-based organizations. So an example how a community-based organization can participate in this ecosystem would be a local church hosting a blood pressure screening event, or even barber shops, food banks, or local pharmacies promoting education and awareness of blood pressure control and how to take your own blood pressure utilizing self-monitored blood pressure devices. On this next slide here, I would like to introduce you to our public health team. So these are the quarterbacks that will be leading the NHCI efforts in each state. So as you go through each of us, I'm going to have each of us come off mute and share our screen or share our video so you can see who we are. And then take note of which states we're representing, because if you're located in one of our states, please write down your contact for that person. So we'll be your liaison and your contact with all things NHCI. So I'd like to start with our public health director, Anikin, if you want to say hi to everyone and tell us a little bit about what you do.
Thank you, Amy, and good morning and good afternoon, everyone. My name is Ania Kanebitu, and I serve as the director for the National Hypertension Control Initiative. I'm based in Maryland, and I work closely with the public health program team and our executive director with the daily goals that we have to meet with the 350 health centers. So happy to be here, and I'll be around to answer questions. Thank you.
Thank you, Anikin. Next, I'll have Phil DiPoco come off mute and share your screen or share your video.
Hello, everybody. Hello from Oregon down to Puerto Rico, from Maine to California, from Minnesota down to Texas. Hello, my name is Phil DiPoco. I'm the Senior Public Health Program Manager, and I'm based in Chicago, and I have the honor to be working with our partners in Ohio, in Michigan, in Indiana, and my home state, Illinois. We look forward to having and working with you, and thank you again so much for your interest and your support.
Thank you, Phil. And Masa Massaquoi, if you want to come and share your screen.
Absolutely. Thank you, Amy, and good morning, good afternoon, everyone. So happy to join today's call. My name is Masa Massaquoi. I am also a Senior Public Health Program Manager for the NHCI initiative. I will be working with healthcare centers, CBOs, and community partners in Connecticut, Maine, Massachusetts, New York, New Jersey, Rhode Island, and Vermont. Please feel free to contact me. I'm really excited to continue our work on this amazing initiative.
Thank you, Masa. So that is our senior public health team. On the next slide, I'll introduce you to the rest of our public health team. Excellent. And just as a reminder, write down the contact information for your state if you see it pop up. So Indira, if you want to just go over the states and where you're located.
Good afternoon again. I'm based in Central Pennsylvania. I will be working with health centers in Washington, D.C., Delaware, Maryland, North Carolina, Pennsylvania, and Virginia. Thank you.
Thank you, Indira. And I am covering the states of Alaska, Arizona, Colorado, Hawaii, Idaho, Montana, my home state, Oregon, Utah, and Washington. Mark, if you want to come and say hello to everybody.
Hello, everyone. My name is Mark Mooney, and I'm one of the public health program managers, and I will be covering the states of Alabama, Louisiana, Mississippi, and Tennessee.
Thank you, Mark. Leslie, if you want to say hello.
Hello again, everyone. My name is Leslie Brown. I will be covering the state of California. I am based in Northern California in the Bay Area, and I'm very excited to be a part of the team and to work with all of you. Thank you.
Thank you, Leslie. And Susan.
Hello, everyone. It's a pleasure to join you today on the call. I'm Susan Garrett. I'm based in Kansas City, Missouri, covering mostly Midwest states with a little bit spilling over to the east, but I'll be working with Arkansas, Iowa, Kansas, Kentucky, Minnesota, Missouri, North Dakota, Nebraska, Wisconsin, and West Virginia.
Excellent. Thanks, Susan. And then Tim, if you want to come say hi, he's our newest member. He just started on Monday.
Good morning and good afternoon to everyone. My name is Timothy McCray, and as Amy stated, I am the newest public health program manager, and I'll be covering the great states of Texas, Oklahoma, and New Mexico. I look forward to working with each and every one of you.
Thank you, Tim. We have Lillian Gutierrez Alvarez starting in just a couple weeks, and she'll be covering the states of Florida, Georgia, South Carolina, Puerto Rico, and the Virgin Islands. So if she is your public health manager, write down that contact information, and she won't be starting. So when she starts, she'll address your questions to that email. So excellent. So we'll move on to the next slide here. You can see the distribution of the funded health centers here. So our AHA National Hypertension team will be working directly with those health centers working to address high blood pressure. So this is a very exciting initiative that complements AHA's continued work around high blood pressure or hypertension. We are excited about the opportunities to work with you and your various organizations. So our other panelists will share more information about how your organization can get involved with the National Hypertension Control Initiative. So I'll pass the mic back to Leslie, and she'll do another poll question.
Thank you, Amy, and thank you so much for sharing and providing an overview of the National Hypertension Control Initiative and introducing the team. So our next poll question is, does your organization collaborate with a local community health center in your area? We'd love to know about collaborations and know if you're already currently working with anyone. So I'll give you a few seconds to answer that question.
Feedback's flying in, maybe another 10 seconds.
All right. And it looks like, yes, most of you are already currently working with your local community health centers. That is great. We'd love to hear that information. And thank you so much for sharing it with us. I'd now like to move on to the next slide, where we are going to introduce Mark Mooney, Public Health Program Manager for the National Hypertension Control Initiative based in Atlanta, Georgia. And Mark will discuss the National Hypertension Control Initiative's community outreach and integration. Mark, take it away.
All right, Leslie, thank you very much. There we go. Thank you very much. I would like to discuss with you one of the NHCI's overarching strategies, which is the community outreach and integration for this project. While each community is different, the objective is to build strong strategic alliances with trusted organizations that serve local communities to reinforce awareness messaging and create a strong channel from community to clinic and from clinical care to community wraparound support. We will recruit places, as you heard earlier, of worship, barbershops, beauty salons, as well as community recreation and senior centers, and where it's applicable, local community pharmacies. These partners will be trained and equipped with tools and resources to screen those that they serve. And on the next slide, you will see why we are inviting you to this. We want you to engage with participating health centers, attend AHA NHCI webinars and workshops, assist with community outreach and integration, share AHA hypertension resources, help us amplify the message through your community channels. And on the next slide, there are 3 tracks for you to decide at what level of involvement for your community-based organization. As you see, track 1 is to host community blood pressure screening awareness events, connect community with local health center resources, share educational materials and resources, and evaluate your impact. Track 2, host healthy lifestyle awareness events, share educational materials and resources, and amplify NHCI campaign. And track 3, the ambassadors, to become part of a network, become a part of a network of leaders dedicated to helping to develop a culture of health in vulnerable communities. As I stated earlier, the tracks are for you to decide the level of engagement. Both tracks 1 and 2 involves that your community-based organization hosts quarterly blood pressure screening events in collaboration with local community health centers and distribute educational materials. And we will give you access to downloadable resources from our Empower to Serve, Target BP, and the NHCI Community Health Center Hub sites. And the links will be provided to you either in the chat or after the webinar. And one other thing about track 1, you will be allowed to assess, again, your impact through evaluation. Track 3 allows those strategic alliances at the academic institutions, such as student-led organizations and those local CBOs who are interested in becoming advocates in their communities, creating a culture of health. Track 3 will also involve sharing AHA's information and volunteering at AHA events. Now, all tracks 1, 2, and 3 are designed for your community-based organization to build strategic alliances with other community-based organizations and create that community clinic linkage. Training will be provided by an assigned AHA liaison and through other CBO webinars. Now, at this time, we have a couple of more poll questions for you, and then I will return to close out my section.
Thank you, Mark. We're now going to queue up the next poll question for you all. We'd like to know, does your team distribute a newsletter where resources could be included? Do you have an internal one, external? Do you have both, or do you have none of the above? This information is so helpful when we're trying to gather resources for you all. Give you a few more seconds to answer that question.
10 more seconds and we'll close it.
Okay. Thank you all for participating. It'd be no fun if you guys had to just sit and watch all of us. We want to make sure that we're interactive, keeping you engaged. And it looks like, yes, you guys all have both internal and external. Thank you so much for participating in that poll. I've got one more question I'd like to ask you. How often would you like new resources distributed to you and your team? Once a month, every quarter, every 6 months, annually? What works best for your team?
Just a few more moments.
All right, thank you all so much. Looks like once a month and every quarter. Thank you so much for your feedback. I am going to turn it back over to Mark to complete his section.
All right, Leslie, thank you. Welcome back. So some of you may ask, what are the benefits to my CBO to get involved with AHA on this initiative? We have them, the opportunity to showcase that your organization is committed to promoting health and addressing health equity in communities that you serve. Opportunities to create events and programs locally that promote change in your community. Share information, share important health messages with your communities and networks via your social media platforms. Opportunities to build relationship and network with like-minded community-based organizations, and opportunities to gain access to AHA's resources. And on the next slide, what you see here is a diagram of AHA, how AHA will provide technical assistance support for your community-based organization. As you can see in Tier 1, the National Webinar Series, it consists of scheduled webinars to provide trainings, updates, and support. And within these webinars, we will identify best practices and lessons learned, featuring guest speakers. And who knows, one of you all might be one of our guest speakers. Access to recorded webinars located on the NHCI Community Health Center Hub, and other practice tools and resources. Tier 2, to support community engagement activities, which consist of, as I spoke about earlier, the BP screening and awareness events, linkage to NHCI partnering health centers, and program management and evaluation. Tier 3, educational resources, again, providing you with a plethora of blood pressure educational materials, focus on applying practice tools and resources, and other online web content. And the last tier, Tier 4, is that one-on-one technical assistance, and that's as needed, and that will involve a dedicated AHA liaison. Thank you for listening to me, and at this time, I would like to turn it back over to Leslie Brown. Leslie.
Thank you, Mark. Thank you so much for sharing the information with us on how organizations can get involved. I'd now like to turn it over to Susan Garrett, Public Health Program Manager based in Kansas City, who will share with you what the next steps would be for your organization to get involved with the National Hypertension Control Initiative. Take it away, Susan.
Thank you, Leslie. Well, now that you've heard and met the team members, and you've heard about the goal of the NHCI and improving hypertension outcomes and the opportunities of making an impact in your communities through this alliance, maybe you're asking yourself, this sounds great, but how can I get involved? Or what are the next steps in this process? And those are fantastic questions. And it's really quite simple what to do next. So let's look at how we can answer those questions. You know, as you heard at the start of today's webinar, a really important component to the success of the initiative is to form an alliance with the community-based organizations to support blood pressure education, to support blood pressure screening, and health promotion. And we want to cultivate a community network between healthcare providers, patients, caregivers, and of course, you, the community-based organizations. At the conclusion of the webinar, we encourage you to take some time to digest the information that you heard today, share it with others at your organization, talk to them about how your CBO could get involved. So what are those next steps? You see them listed here. First, it's really just figuring out what works for you. We just heard from Mark, who very nicely laid out what those 3 tracks are. So take some time to consider that. And then the next step really is quite simple. We're just kindly asking that you complete an online form with your contact information. And one thing that I'll note within this form, we just ask that you please complete the information of the person within your organization who should receive further notification about the initiative, about NHCI, and also about next steps. So here in this slide, you can see a screenshot of what that online form looks like. Again, very simple. It should just take you a few minutes And I think we're going to also include a link to this in the chat. So you could even, take a few moments now to complete it. Very simple: name, email, name of your organization, the location, what is the contact information, and also what type of organization do you represent? Maybe it's a senior center, a social services agency, perhaps faith-based, so on and so forth. I know we have great representation with us here today. We kindly ask that you complete this form by August 11th. And one last note before I wrap up this section, I do want to highlight how you can help us to build this community network. And not only across your local communities, but really across the country. This is a national initiative. And as you can see by where all the program managers will be working, we're going to be in many different communities. So if you know of other organizations in your community that might be interested in joining the strategic alliance with the American Heart Association and those local health centers to help improve blood pressure control rates in your community, please feel free to complete a separate contact form. So you can use the same form for another organization and you complete their information, and we will reach out to them to invite them to learn more about the initiative. I also want to note that on the NHCI webpage, you will see a familiar contact form that's available in English and in Spanish in case you need to perhaps direct others to get more information. All right, so coming up, I think we have yet another poll question. Going back to one of Leslie's comments, I love this. It's a way for us to really interact with you. So how would your organization like to receive resources? Do you prefer digital, print, perhaps both?
Great response rate. We'll give it another 5 seconds or so.
All right, so it looks like the majority prefer both. Thank you so much. We have another poll question related again to educational materials. This one is really highlighting the level of educational materials that you or your team need the most. So, think about your local community, the team within your organization, or perhaps even closer to home. Maybe you're a caregiver or you know someone who is. So what level of educational materials is most appropriate? Okay.
A little bit more reading on this question. Let's give it maybe a few more moments.
Very good.
Getting a good response. We're almost there.
Okay, very good. Thank you so much for those responses, everyone. All right, I have one more poll question for you here. This one's a little bit different. You're going to see the question on the screen, but if you could type your response into the chat, that would be much appreciated. We really need your help in learning about what are the specific language needs for the population or populations in your local community. So are there specific language needs for the population that you serve? All right, I love what I'm seeing in the chat, a wide variety of language needs. All right, and keep those coming. So as those are coming in, I think we can move on to the next slide. So in the next couple of slides, just want to show you some example resources. The American Heart Association has a plethora of blood pressure resources that are available. These resources help to train and support community-based organizations around the country to help their neighbors understand and manage their blood pressure. So we're going to take a look at some of those now. We're going to start with this video. And this video gives a very user-friendly demonstration on how you can properly measure your blood pressure at home. So let's take it away with the video.
Okay, let's have a real talk about blood pressure. Do you monitor yours regularly? It's something everyone with high blood pressure should do, but it's something most people don't know how to do correctly. Checking your blood pressure regularly will help let you know if you have it under control. It will also help you start to understand which factors are putting you at high risk for stroke and heart attack. Before I get to that though, I just want to stress one thing. If you have high blood pressure, you should talk to your doctor to figure out how frequently you should be checking it at home. For most people, taking your blood pressure twice in the morning and twice in the evening, even just for a week, will help you and your doctor get a better understanding of your blood pressure. For morning readings, it's best to take those before you take your blood pressure medication. It's also very important to avoid exercise, caffeine, or tobacco at least 30 minutes prior to testing, since those can affect your levels. Now, let's move on to talk about the proper way to measure your blood pressure at home. Nearly half adults in the U.S. have high blood pressure and are at high risk for stroke and heart attack. So self-measuring is one of the easiest ways to be proactive about our health. Here I have my blood pressure monitoring device. It's easy to use and it helps me get an accurate reading. Be sure to get an automated device with an upper arm cuff. That's the type doctors recommend. The first thing you want to do is find a quiet place to sit where your back is in an upright, stable position. A dining room chair is great. You want to make sure the chair isn't too soft so your body is fully supported. Sit with your feet flat on the floor and don't cross your legs or ankles. If you need to use the bathroom, make sure you go before you do your reading. Next, rest your arm on a flat surface with your palm facing up. Place the blood pressure cuff on your bare upper arm just above your elbow. Your arm should be relaxed and resting so the cuff is at the same height as your heart. Now rest quietly for 5 minutes before taking the first measurement. Avoid talking while taking your blood pressure measurement. Once your first measurement is completed, write down the blood pressure numbers and pulse that are displayed on the device. Wait 1 minute and then repeat this process again. As you just saw, it's important to check your 2 measurements at around the same time each morning and evening. At your next doctor's visit, be sure to share your blood pressure numbers so you can discuss the numbers and so your care plan can be changed if necessary. That's it. Not bad, right? Measuring your blood pressure at home is easy to do and a great way to stay on top of your health. If you have more questions about managing or measuring your blood pressure overall, visit the website. Okay, let's have a...
All right, well, I hope you enjoyed the video. Did any of you learn something new? Maybe perhaps some of you out there thinking, I haven't been following those steps exactly to check my blood pressure. So again, this information is really important for all of us and just a great tool for anyone in the community. Within the NHCI website, you will find a link to the Community Health Center Hub. So you see a screenshot of that here, the Community Health Center Hub, and this page is specifically for community-based organizations. So we really encourage you to check out the webpage and look at those various blood pressure resources that are available to you. On the next slide, we're going to take a look at another resource. This is a little bit different format. So we saw the video format. This is more of that infographic type of resource. It's available in English y también en español. Tenemos muchos recursos. So you see that, again, it's just an easy to understand instruction on how patients or program participants can properly measure their blood pressure. I will note that not all educational materials are offered in Spanish. However, we are working to produce more materials in different languages to better serve those local communities. So again, going back to that poll question from just a few minutes ago, it's really important for us to learn how we can better serve those specific language needs in your local communities. We do have other resources, and we have an example on the next slide. So again, we have some available in English and Spanish, but we have other languages available as well. And then in the next slide, this is kind of not switching gears necessarily, but highlighting once again the website. So we really do encourage you to log on and see what the NHCI website has to offer. Again, you'll find further details about the initiative. You'll find links to many of those wonderful blood pressure resources. One final reminder, please don't forget to complete that community-based partner form with your information by August 11th. If you haven't already done so, again, that link is in the chat. And again, please complete the form for other organizations who you think might be interested as well. So I am really looking forward to getting to know you and working with the Midwest states and just seeing how we can partner and what we can provide for those local communities. So with that, thank you all for your time, and I'll hand it back over to Leslie.
Thank you so much, Susan, for providing all of the information about the resources that AHA has and how your organizations can get involved with the initiative. I know we've covered a lot of information today with you all, and we want to make sure that we leave here with you all feeling like you have a good understanding of the initiative and how we can all work together to move forward in this initiative. So I'd like to ask you all to please provide your feedback at this time, ask any questions you may have, share your thoughts or comments with the group. Please use the Q&A button. I'd also like to invite Anikin, Phil, and Masa, our Senior Public Health Program team, to the floor as well to help answer any questions that you all may have. I'm going to check out the Q&A here.
Thank you so much, Leslie. I think we actually started answering a couple of the questions for the Q&A, but please provide us with any additional questions. We'll do our best to answer. So the slide will be available at the conclusion of this call. We will email it to all of the contacts. We will also provide the link for the validated devices, and we also can provide the link as well for the how to properly check blood pressures. I also saw a question about the video in multiple languages. Now our videos will be in English, and we do have some of our videos in Spanish. We are exploring other languages. I think we've captured the languages shared on the chat box, and we'll share that with our leadership team as we explore other languages.
Thank you, Anikin.
What other question? Would there be funding to purchase automated blood pressure cuffs? Marilyn, if you can kindly email us at nhci@heart.org, we can try to answer that question and provide you with additional feedback and resources. I'm not sure if I answered all the questions, but kindly correct us. Leslie, please.
I did see one question in two in the chat. Is there an opportunity to select all 3 tracks if we are interested?
Yes, you can definitely select all 3. I'm not sure there's an option on the link that was shared. And if that isn't, you can definitely email us at nhci@heart.org to schedule a time to meet with us to explore that. So yes.
And I think that was it, Anikin. I didn't see any other questions inside of the chat.
Okay. Then if you have any additional questions, comments, or concerns, please email us at nhci@heart. If you need to meet with us, we'll be happy to engage and probably schedule a time. We're also looking forward to additional meetings in the next month, so please look out for that. I think I see additional questions. Leslie, can you read them out?
Yes. Can you provide region-specific CVD demographic data?
And that's from Paul. If you can kindly email us at nhci@heart.org, I think we can try to engage you with that question, please, and also engage our clinical team.
Also see here, as a CBO providing education and resources, is it beneficial to provide case management for BP improvement?
I would say yes, but Andrea, if you can kindly email us as well, and we can try to see how we can tackle that question that you have, and also probably engage our clinical team to assist with that case management for BP improvement.
And then I see here, how best do you feel health plans can support the efforts given the real direct services are provided by our provider network partners?
I'll probably defer that question to Pamela, but I think we still will have to connect with, and that's from Roderick. So if you can just email us that question, I think we'll be able to engage with the provider network partners, please.
And I see here, how can we get college students to get involved with the AHA for this initiative while they are on the college campuses?
And that's a great question, Stephanie. I think, of course, we do want college students to be involved. I think it'll be great if you can send us an email so we can see what states you're located. And then our public health program managers can engage with you to see how we can either connect with the university or the colleges around your area. But we are definitely looking into partnering with universities and colleges.
I think that was all the questions. Anikin?
Thank you, Leslie.
Leslie, I wanted to also include one of the frequently asked questions to the program team is, what support and resources are available to our community-based organizations? And as we shared during the webinar, there is certainly a link for you to check out our website, but also just to be assured that we will be providing continuous contact communication with our CBOs over the course of this initiative through website, online shareable tools, educational materials, community blood pressure screening toolkits that we plan to create and develop, and ongoing webinars, as well as just reaching out to us as your liaisons, and a newsletter that may be developed for this project. So just wanted to share a couple of resources that we have planned for our community-based organizations, and we will continue to contact and reach out to you all for continued collaboration.
Thanks, Masa. In addition to that, we're asking all of our CBO partners to consider filling out that form. We're going to take a look and ask everybody to complete it within the next 2 weeks. I know Susan ran through it and she essentially said we can get it done relatively quick, but take the time to talk to your community-based organizations, find the right individuals, and when you submit your contact people, we'll be able to take the next steps. We will be having future CBO webinars to dive into more of the details regarding our campaigns and show you and share and have our partners share what they're doing as well. So please fill out those forms, send it back to us within a 2-week window if you can, and we'll schedule the time to make those next steps and reach back out to you, provide you the next date and link for our next webinar.
Thank you so much, Phil, Masa, and Anikin for answering all of the questions and providing all of the information. We thank you all so much for joining us today. We hope you found value in this session and that it has met and exceeded your expectations. This webinar has been recorded and a copy of the webinar will be sent to the registered emails for today's event. So please share it with your team members participating in the National Hypertension Control Initiative. We hope you all have a wonderful, great rest of your day. Thank you.